This is the fourth presentation of this series. In OCT, which is more important, the ganglion cell of the macula or the peripapillary nerve fiber layer? Both are important. Both help in the diagnosis of glaucoma. In the peripapillary nerve fiber layer, normally we look for the profile of both eyes when they are similar, when they follow the double hump, when they follow the isn't rule, then we believe we are dealing with a normal person. For diagnosis of glaucoma, decrease in the average thickness of the nerve fiber layer is the most diagnostic sign, but still you will have changes in the lower temporal zone. This comes next in the frequency of diagnosis, and lastly in the upper temporal zone. In the ganglion cells, we have different machines, and each machine measures a different thing. In the Heidelberg, it measures the ganglion cell only. In the Zeiss, it measures the ganglion cell with the inner plexiform layer. In the OptiView, it measures the ganglion cell, inner plexiform layer, and the nerve fiber layer. So you cannot compare the machines, but all agree that there is thinning in case of glaucoma. Again, when this thinning respects the horizontal line, then we are more certain of the diagnosis of glaucoma. In the OptiView, if the factor of the loss variance, focal loss variance or global loss variance of the ganglion cells on the macula are abnormal, then the diagnosis of glaucoma is more likely. Again, if you find changes in the ganglion cells are going on similar to changes in the peripapillary nerve fiber layer, then you are more certain of the diagnosis. In this example, here are the changes in the macular area, and it is continuously seen with the changes in the nerve fiber layer here. Again, if the field changes correlate with the same changes, then we are more certain of the diagnosis. So both help the diagnosis. But keep in mind, sometimes we see such changes in a normal eye. In this study, 150 persons healthy, around 1/4 of them shows changes in the nerve fiber layer around the disc. This is one of the cases with changes in the OCT, but fundus normal, field normal. Again, ganglion cells, they help in the diagnosis of glaucoma. This is in this study, these are the group of 130 patients. This is the incidence of changes in this group. But also the same study showed that a group of 132 normal persons, they show changes. This change was visible in 21% of the normal. This change was visible in 28% of the normal. This change was visible in 15% of the normal. The last thing is ganglion cells help in neurological affection. In case of chiasmal compression, ganglion changes occur, but the idea they occur in the supranasal and infranasal in comparison to glaucoma, which occurs in the temporal. So this is an example of chiasmal affection with field changes typical of neurological affection. And as you notice here, the ganglion cell affection is nasal to the fovea. And again, around the disc, it is on the nasal side. Another example, still no field changes, pre-perimetric case. Again, affection on the nasal side of the fovea. This goes with neurological and not glaucoma. So, to sum up, ganglion cells and peripapillary nerve fiber layer both help the diagnosis of glaucoma, especially when they go hand in hand, especially when the ganglion cell respect the horizontal line. Keep in mind that such changes may occur in a non-glaucomatous normal eye. And keep in mind, in case of neurological chiasmal compression, ganglion changes occur onto the nasal side of the fovea. Thank you for your attention.